Lot of parents of young children between the age of 2 to 6 years of age reach out to us very distressed that they found their child playing with their private parts, rubbing their private parts, and these parents are often very worried and distressed कि क्या ये सब normal है, क्या ये बहुत young नहीं है अभी masturbate करने के लिए, why are they doing it? See, as a parent, your concern about this behavior of finding out that your child, your young child, is rubbing their genitals, is also enjoying it, could be kind of shocking and surprising for you. बट जितना ही आपका ये कंसर्न नॉर्मल है, आपको ये जानना ज़रूरी है कि आपके ये बच्चे का जो बिहेवियर है, इट्स यूजुअली इनसाइड ऑफ क्यूरियोसिटी, वो बिहेवियर भी उतना ही नॉर्मल है. आपका बच्चा जब बड़ा हो रहा है, इनफैक्ट बच्चे काफ़ी छोटी उम्र से ही अपनी बॉडीज़ को एक्सप्लोर करना शुरू कर देते हैं. When they reach this age of about 2 to 2.5, 3 years of age, they have more access to their genitals. Why? क्योंकि अब डायपर्स उतर चुके होते हैं, मे बी ज़्यादा पॉटी ट्रेनिंग हो रहा होता है, and their focus is more on that area of their body. So inside of this curiosity, they probably touch themselves more. The more they touch their private parts, they also recognize कि ये तो उनको अच्छा लग रहा है, करके उनको गुदगुदी सी हो रही है, and their intent of genital stimulation is then based inside of curiosity and self-soothing behavior, and it doesn't have anything sexual in nature at that point in time. This is a natural part of their healthy development and exploring their bodies. It is called genital stimulation and not masturbation. In fact, small young boys who are playing with their genitals might also have an erection, which is also a normal part of this genital stimulation. In fact, the difference between masturbation and childhood genital stimulation is that often the latter stops the moment the child gets distracted or redirected to some other play activity or any other activity. काफ़ी बार पेरेंट्स ये भी बताते हैं कि यार हमारे बच्चे की कंप्लेंट आई है कि वो अपने जेनाइटल्स, अपनी पैंट खोल के अपने जेनाइटल्स, प्राइवेट पार्ट्स दिखा रहे हैं, एंड दे आर वांटिंग द अदर peers to also show their private parts. They are playing doctor wherein they are touching each other's private parts. This is also very common behavior driven inside of curiosity. What else is also normal is that they also have increased interest in understanding the differences between bodies of themselves or of somebody of the other gender, or how the adult bodies are different from their own bodies. In fact, ये behavior काफ़ी ऑफन देखा जाता है, ये क्यूरियोसिटी काफ़ी बढ़ जाती है जब इन बच्चों के आसपास कोई नया सिबलिंग आता है या घर पे कोई नया बच्चा आता है, या जब भी वो कोई एक छोटा बच्चा देखते हैं, और बिकॉज ऑफ दिस न्यू सिबलिंग, व्हेन द मदर इज़ ब्रेस्ट फीडिंग, व्हेन दे काइंड ऑफ get exposed to that breastfeeding, they also become interested in how their body is different from their mother's body, or how their somebody else's body is different. So all of these form a very normal part of their curiosity. Showing your own genitals to your peers or to your siblings is again a very normal part of their exploratory behavior. So what should you do as a parent? सबसे पहली बात, please 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 do not scream, yell, shame or scare your child. Please stop telling your child कि आपका सुसु टूट जाएगा, आपके प्राइवेट पार्ट भूत उठा के ले जाएंगे. ऐसा कुछ नहीं होता है. Do not do that. Your negative responses are only going to backfire. It's only going to make the behavior more tempting. Also, you're also giving them this message that your body is bad and it is something to be shameful about. In fact, as a parent, अब जब आपको दिख रहा है कि आपका बच्चा curious हो रहा है, it's a great opportunity to sit with your child and talk to them about different kinds of body. Give them the correct anatomical names for their genitals. It's penis, testicles, vulva, buttocks, and not these other absurd names and nicknames that you give to your genitals. It also becomes important that at this point in time you talk to them about what is okay touch and what is not an okay touch. This also establishes the conversation around that since these genitals of yours are private, they are supposed to be touched and cleaned in private and not in public. When is it that I should be concerned? सी कई बार ऐसा होता है कि जेनाइटल स्टिमुलेशन एक नॉर्मल पार्ट है. इस जेनाइटल स्टिमुलेशन से बच्चे को अच्छा भी लगता है, वो सेल्फ सूदिंग भी होता है. तो कई बार इफ़ योर चाइल्ड इज स्टिकिंग टू इट, इज़ डूइंग इट मोर ऑफन, एंड आप उसको रीडायरेक्ट नहीं कर पा रहे हो, बट वो बार बार ही इज़ गोइंग बैक टू टचिंग देमसेल्व्स क्वाइट अ लॉट, इट माइट बी इंडिकेटिव ऑफ सम अंडरलाइंग स्ट्रेस. स्कूल में कुछ ऐसा हो रहा होगा, प्लेग्राउंड में कुछ हो रहा होगा, घर पे कुछ ऐसा हो रहा होगा जिसके बारे में शायद वो स्ट्रेस्ड है, एंड यू माइट वांट टू मे बी सिट एंड टॉक विद योर चाइल्ड अबाउट. if this genital stimulation is happening at the expense of other activities, वो बाकी सब छोड़कर अगर ये कर रहे हैं, it needs to be checked. If there is persistent sex play with toys, friends, pets, it's also something that needs to be looked into. ऐसे detailed सवाल पूछना about sexual practices which are not appropriate for a 5 or a 6-year-old is also a cause of worry and concern. Showing of genitals between siblings or peers that are 4 years apart from each other is also not normal. If you see that any of this behavior is persistent, is causing pain to your child, there's a bruise around his genitals, is the child is not doing anything else but is consistently, persistently, obsessively playing with their genitals, these are the times that you need to reach out to your child's pediatrician or a mental health professional to look out for that what might be going on. There might be underlying stress or there might be some abuse that's going. If you have any other questions regarding this, please drop your questions in the comment box and do subscribe to the channel for more such information on mental health, psychology, child development.